everyone. Welcome to the Workplace Wellness Forum. My name is Joyce Edison, and today I have Dr. Tyler Amell with me, and we are going to have a nice conversation like we always do with all my guests here, but you're going to learn some few things from him because I know he's such an incredible speaker. I love speaking to Tyler, and he has so much knowledge. So look forward to hearing from him. Tyler, welcome here. Tell us a little bit about yourself. Introduce yourself to the audience.
Thank you very much, Joyce. It's my pleasure to be here today. It's always great to connect with you. I always enjoy our conversations. So a little bit about me. I'm an occupational epidemiologist by training. So that's a big fancy way of describing people who have an interest in how people get hurt or sick on the job and what we can do to stop others from becoming hurt or sick. So in times of a pandemic, as you can imagine, time is at a premium. Nobody really listens to epidemiologists outside of a pandemic, and suddenly when a pandemic occurs, everybody's a rock star who happens to have an interest in this. So, my schedule has been quite full over these past few months, and but one of the things that it has done is it's very much shown a light on employee health and productivity, and particularly needs around how we can help people improve their risk profile and decrease their risk of chronic disease, and all the things that we know align quite nicely with well-being initiatives. So if anything, we've gone through an awful lot. Our economy has. There's been a lot of fatalities, but at the end of the day, this is something that I think has forced us to shed light on various things of great interest to those in the health and productivity and well-being communities.
Absolutely. I am so glad there are people like you in the world because, I have a saying that I share with my audience. I say, what happens at work permeates to life. And all of us go home and talk about that person who made our lives horrible or made our lives, made it a great day today. We all do. And we want to be the person that others say made their day better that day. So nobody wants to get hurt. When someone gets hurt at work, it affects their family, it affects their income level, it affects their social network. So there can be a long-term ramification far more than the workplace, because the workplace is where we earn a living so that we can go back out and have a full productive life. So when you are looking at what's happening right now with COVID-19, what are you seeing? You said you've gotten very busy. What are some of the things that your clients are telling you or coming to you for in a time like this?
Excellent question. I used to preface this statement with my students all the time. People spend a third of their lives sleeping, a third of their lives at work, and a third of their lives essentially living. So an imbalance or something impacting any one of these is going to have repercussions. So you're quite right. Looking at these sort of things through that lens definitely does change your perception of things. Now, with regards to what people are yearning for these days with regards to the SARS-CoV-2 virus and COVID-19 disease, it's very much good quality sources of information. Unfortunately, there's a lot of misinformation out there, and that is impacting people's strategy and their ability to institute control mechanisms, mostly in the workplace. And of course, I focus on the workplace more than anything, so I'm quite in tune with what's going on there. But that's probably one of the biggest barriers we have. We've never encountered, at least in our lifetimes, something such as this that we'd have to, look at through the lens of basic science. You get an understanding of how this virus behaves, how the disease behaves, and then of course how we can learn from that to channel our efforts towards, vaccination as a control strategy. But in the meantime, what works and what doesn't work. Does everybody need to stay away, or can we function as a society with the virus out there? I'm a firm believer that yes, we absolutely can. We just have to change a few of our behaviors. It's quite similar to how we approach chronic disease. If we actually adopted a few different behaviors, we wouldn't be in the predicament as a society that we currently are. So I think looking at things from that perspective definitely does make a lot of sense. So employers are definitely looking for good quality information. They're looking for evidence-informed strategies on what works and what doesn't work, and where they can allocate resources as they look to support their employees, particularly as people re-enter the workforce or re-enter the workplace more so. I think we have to be very cognizant of the words that we use. Earlier on, people would talk about return to work. Well, usually from a work disability lens, when you talk about return to work, the implication is that you weren't working in the meantime. And that's not the case. There's ample evidence to show that in many instances, people are actually working more, longer hours and higher productivity than they were prior to the pandemic. So it's not about returning to work. It's about returning to a different place of work that you've been used to over the near term.
Absolutely. It's interesting. A number of things came to me as I was listening to you talk about employers looking for good information, right? Reliable information so they could make informed decision on the well-being of the employees, because there are so many things you have to take into consideration now. I was going to the bank. I went to the bank and there was a lineup. And actually, we have to line up 6 feet apart. And, I had to use the hand sanitizer, and there's a screening question. So I say in my podcast, like, hey, you can't even go to the bank. It doesn't matter how much money you have there. You can't go there if you're not well. Wellness is now a key factor for success to access resources, basic resources such as food, basic needs, food, shelter, prescription. If you're sick, you can't go to the pharmacist. If I was talking to my physician on the phone, my family doctor, and he says, if you think you have COVID symptoms, you would have to phone before you go to the emergency. I don't think they would want you to just stroll in if you think you. And I was like, wow, you're not even the doctors want to see you, in their office, because we're thinking about protecting others. We're thinking about how virulent this disease is, and it's so invisible because you could be perfectly healthy and be a carrier of it. And I think that's the biggest thing that makes everyone nervous. So what I was thinking about when you talk about that employers wanting more information, what are they struggling with? Like, what are some of the things that, there's pushback, the people not wanting to stand in line or answer the questions, but what is it there? Give me an example of some key things that they're asking for.
Yeah, it's a great question, and you bring up a very relevant point. Earlier on in the pandemic, we really didn't obviously understand the disease, the clinical course, what the risk factors are, and so on and so forth. A lot of us were quite surprised by the level of what's called asymptomatic transmission. So that's somebody who is not necessarily exhibiting the telltale signs, which is a fever, a shortness of breath, and those sort of things that we know are quite common. So people who have a milder version of the COVID-19 disease don't actually present with any of these symptoms whatsoever, which makes it quite difficult to control. It also means that there's probably a lot more people out there who have gone through the infection without necessarily knowing that they have, and they've developed an immune response. And of course, there's serology-based studies that are out there to help determine that. And some people have looked at that utility from a workplace health perspective on if somebody has an immune response and does demonstrate some levels of what are called antibody titers, that they can actually return to the workplace without all the controls. Well, that's not necessarily the best thing to do, and plus we have issues with the reliability and validity of these tests and so on and so forth. They're part of an overarching strategy. So from many employers' perspectives, aside from good quality information, specifically what they're looking for are ways to help design the workplace and support their people. So it's very much around obviously stopping outbreaks or clusters from occurring in the workplace, because that's the last thing you want is to be, especially if you're a workplace that has the public in place. You want to make sure that you're protecting your people, but also people who are visiting your site. Perhaps that's a bar or a restaurant or a pharmacy or a hospital even. Grocery stores are great examples from that sort of perspective. So we do have good quality controls in place to do this as long as people are adhering to the practices. So the practices that we know work quite well are, of course, physical distancing, making sure that you're 2 meters away from somebody or 6 feet. And if you are going to be in close proximity to somebody, wearing a mask, both for you and for them, does make an awful lot of sense. It'll drive down your risk substantially. Now, one of the most important factors is time. So how much time you actually spend with somebody. If we look at evidence-informed guidelines from perhaps the Centers for Disease Control Prevention in the US and a few other entities, they peg that at about 15 minutes. So the odds of you getting infected, for a very short interaction with somebody in an unmasked condition is pretty low. But that doesn't mean that it can't happen. It most certainly can. So you always have to factor that into your decision. So employers are very much looking for this. Now, the other thing employers are looking for is obviously justification for improving their traditional approach to health and well-being. There is influenza vaccination programs that exist as part of a well-being strategy. There's the Cover Your Cough campaigns. There's respiratory etiquette, which is becoming mainstream now. Everybody's talking about respiratory etiquette as being, a pillar of an occupational health strategy, which definitely does make sense. So when you combine these with other types of controls, such as putting up barriers to interrupt airflow in between individuals and making sure that hand sanitizer is available for people to use, your hands are clean, just like with your example of going to the bank, that there's reasons for all these things to be implemented. So what you're trying to do there is decrease what's called fomite transfer. So fomites is when you actually touch your eyes or your nose or your face after touching an infected pen or something from that perspective. So that's what employers are very much looking after. Now, one of the things that I've been focusing on with employers is very much helping them understand where this fits in with their grand approaches or their overall strategies around health and well-being. We know that people who are obese have a much harder time dealing with COVID-19 should they become infected, and do have a greater likelihood of having a negative outcome. So, for example, lasting issues with breathing, or perhaps more complications, or perhaps even increased risk of fatality. So this does underscore the rationale around decreasing your risk profile for chronic disease. So we're talking about heart disease, lung disease, type 2 diabetes, great example. Helping people really understand that investing in the health of their people earlier on makes sense, not just from a pandemic perspective, but from a generalized business sense, and really underscoring the need to help people address these risks that they are incurring as part of their daily lives, and then using that as a stepping stone, if you will, for broader, more integrated approaches to workplace health.
Thank you for that explanation, because one of the things that we've been challenged with for many, many years is helping organizations to value well-being at work. Why is it my problem? Why can't people take care of their wellness? Why do we have to bring that at work? But the reality is, if you have employees who are not healthy, it's costing you money. It's costing you money in sick time, in absenteeism, in presenteeism, where they're not able to concentrate on their work. They're having, brain fogs and just not as productive as they need to be. So there is such a cost to having ill employees. And there's nothing, I'm not in any way advocating that you should get rid of your sick employees. I'm saying invest in your employees so that they can maintain well-being, and invest in your wellness program so your employees can get the resources they need. What we see is that often there's been some hesitation, and we've seen the level of participation in the workplace wellness programs have not been what they've been touted to be, or the expectation. So organizations have invested in well-being programs, and yet they're seeing very low participation rate. And that has been very disheartening for a lot of organizations as they look at what's happening. Well, we put all this money and nobody's doing that. And there are a lot of different factors and variables that could play into why they are. But it's such a wide-scale problem that we know there is something else and there are many other things that needs to be looked at for each program. And there are programs that are working very well and have very high participation, but they're still in the minority. So in your work with organizations as they are going about and the process of instituting workplace wellness program, instituting health programs, really health improvement program, because that's really what it is. It's about educating your employees on better health options and possibilities, and health, illness prevention programs, because we don't want to wait until they're sick. We want to get people to stay well, because it's so much more cost effective to stay well than it is to get well after you're sick, get healthy. So when you look at your work in that regards, how much of that is a concern for your clients in terms of, will they participate? Will they use it? What is my return? How do you respond to that?
Yeah, that's an excellent question, Joyce, and it leads into my presentation at the conference. So very much focused on evidence-informed strategies. What does the research actually show? Because if you're not using evidence to guide your interventions or your assessments or your programs or your policies, it's very much opinion-based, and it's not really based in reality in that sense, although somebody could say that their opinion is reality. But at the end of the day, there has to be some good quality research evidence to really guide our strategies in that sense. So, myself, I wear a few hats. I have a faculty appointment at Pacific Coast University for workplace health sciences, so very much an evidence-informed strategy. I'm also the chief health officer and chief relationship officer at a digital engagement company known as Core Health Technologies. So we actually have solutions to help people understand their risk profile and then change their behaviors over time. I also sit on a couple of different boards, one of them being the National Wellness Institute based in the US and also on the Work Wellness Institute based in Vancouver. So, I've got a very good lens with which to look at this sort of issue, and of course bring that to bear on conference presentations such as the one we're planning for your event, as well as several others that exist out there. So, I do have, access to lots of research. I even conduct some of my own research when needed to help answer these types of questions. And I think you're right. There has been, we'll come back to the concept of misinformation. Well, not really misinformation, more aggressive marketing, if you will. I've personally been invited by employers to help them vet out solutions for their well-being or their health and productivity solutions, whether they be for prevention or perhaps for absence leave and disability management, or even EAP solutions from the employee assistance programming side. And I've heard some pretty wild predictions on return on investment, because return on investment does resonate with some employers who are looking to contain costs for absenteeism or presenteeism estimates or work disability, perhaps pharmacy spend, healthcare spend, extended benefit spend, all these sorts of things. And so, I've seen some rather dramatic numbers presented without a lot of research evidence to show that. What I can say unequivocally is that there is good quality research that does support investments into health and productivity strategies that help people understand their own individual risk as well as organizational risk, and then support people throughout a strategy to reduce their overall risk profiles and increase their quality of life, perhaps increase the amount of quality of sleep that they have, the amount of physical activity, nutrition, all these sort of things that we know contribute to a much healthier lifestyle. Now, the downside is that most of this research does not show a significant return. We're not talking, $10. We're not talking $15 per dollar spent. We're talking significantly less than $5 spent. But even if you were neutral, or in fact it had a cost outlay that didn't generate a return, it's still the right thing to do from a health and productivity perspective, because it does actually have an impact on people's lives when you can get the engagement levels up. Now, behavior change is a very difficult thing to achieve. Just look at, if we were to go out, you and I, walking on the streets of Winnipeg and ask people how many people thought that smoking was bad for them, I guarantee we'd get near 100%. But you still have 20% of the population that smokes. So there's that, implicit bias, if you will, that perhaps, the health implications of smoking aren't necessarily going to catch up with me. I remember I did a research study years ago where we interviewed smokers, and we tried to get to the bottom as to why they continued to do it. Of course, it's a very addictive substance. It does have repercussions. A lot of them had family members who were trying to convince them to quit, but it wasn't until they internalized on the cost and the actual factor that this is going to have dramatic effects later on in life. Some people really didn't consider that once they got older they were going to have to contend with this. Some people who are much younger decided that, well, that's just something that's so far out, I don't have to worry about it now. Whereas, you can kind of see the tricks that your own brain plays on you with regards to how you manage your risk profile. And of course, that's just one example. Obesity is a prime example as well. It's a slippery slope. You don't become obese overnight, right?
No.
This is a long, slow process. And that leads into the return on investment question. Some people talk about things from a value on an investment perspective as well, because it's a slightly different way to look at things.
Mm-hmm.
Now, you will not generate a return on investment for a well-being initiative as part of an overall health and productivity strategy for a couple of years, simply because it takes that long. We're dealing with chronic conditions that didn't arrive overnight. It's a little bit different from dealing with a workers' compensation or an injury or illness program in the workplace, which is dealing with much more acute situations. So we're looking at shifting people's behavior over time, and these things take time, not only to affect change on behalf of people, but also the ability to measure that down the line.
Absolutely. You're so very correct, because when someone gets health and wellness information at work, education, and they've consumed it and internalized it, they go home and they make different choices at home. And it now affects their family and their extended family and their social network. So it really does permeate to our lives. I've had so many clients who have gone ahead and make changes in their family and extended family just based on the work we've done with them on wellness competencies and mindset. So it is so relevant to our society, the way we live, and the results, the cost of healthcare, especially here in Canada. We have universal healthcare, and everything that we can do at work or in any aspect of our society that would benefit our reducing the cost on our universal healthcare, I think benefits all of us. So we're all in this together. And as that investment sometimes is investment in the well-being of our world, and not necessarily in just our pockets, but for the first few years.
Yes, very true, Joyce. And the sense of community is very real. And because we are all in this together. If we look at it even through the COVID lens, absolutely.
Exactly.
As a country that does have universal health care, we're the envy of many nations, right? Because we do have this approach. And of course, it is a community-based strategy. And it does make sense for us to be cognizant of these sort of things.
Absolutely. So, Tyler, you mentioned earlier that you about core health. Now, I know a little bit about core health, but tell our audience a little bit about core health, um, and what it does in the marketplace, because I know it's a health and wellness technology, but tell us a little bit more about it.
Sure, absolutely. So Core Health is a Canadian-based organization headquartered in Kelowna. Very old by tech standards, over 15 years old. So this isn't a recently pivoted or a startup company or anything like that. Long-standing tradition of providing top quality technology solutions to organizations who are interested in investing in the health of their people or in providing those solutions to other organizations. So Core Health has various elements of a software program and software solutions that would help people assess their risk. So you can assess risk a couple different ways. You can ask people questions. You can use standardized surveys. You can use wearable tech-based assessments to help people understand the risk profile. So that's very much the future. So I call that passive health risk assessment, whereby you're using data from wearable technology to understand risk. And in fact, it's more reliable than just having a block of questions or a battery of questions that are based upon self-report. Some people don't remember what they had for breakfast yesterday, let alone their activity levels or where they're at with regards to their healthy behaviors. And so moving away from traditional, what I call active HRAs that are based upon questions into passive HRAs is definitely the future in that respect. So, Core Health has the ability to use a variety of different tools to help people assess their risk, and whether that's from a physical perspective, a psychological perspective, so anxiety risk, depression risk, financial risk, obviously something of great importance these days, spiritual, everything that you can look at through the lens of having, an integrated approach through multiple pillars, if you will, of well-being. Now, of course, once you assess people's risk, the next thing to do is help people change that. So the second part of Core Health Solution is very much focused in on behavior change. So it's engagement, it's giving people challenges to modify their behaviors in a wide variety of aspects of their lives. So whether it's be sleeping or nutrition or moving more or changing your mindset, perhaps building up resilience, demonstrating coping skills, all these sort of things that can elicit a change in your overall personal well-being. Now, the final aspect of the core health solution is providing coaching elements. So this is very much technology to help people understand how they react and deal with other people, and how that can be incorporated into a more personalized journey. So you can actually use video coaching to interact with people from a health coaching perspective. And so you can, subscribe to, digital programming that's targeted. So you can walk you through a process, set your own goals, and then obviously work with somebody on helping you attain those goals. So, core health technology can touch on all of those elements quite nicely and does a very good job. Very popular in the U.S. As well as the Canadian market for companies that supply insurance. So insurance carriers, EAP companies, or health and well-being service providers, as well as employers directly in some circumstances. And so that's pretty much, all the folks who are interested in using this type of technology to help them support their business objectives or support their people.
So I hear that you said Core Health has been supporting for the past 15 years. So there is history there is also credibility and longevity. So instead of just being a startup, which of course is okay, we have technology that's being tried and true, and of course probably provide quite a bit of research too and data for.
Yes, absolutely. So, with that degree of history, which is an anomaly in the areas that we work in, there is definitely, there's a tremendous amount of data, that there's thought leadership in place, and, proven systems that, have been used for long periods of time to help people out. And so, there is a rather significant data set that's tied to that. And in fact, one of the benefits of Core Health is, there is intellectual property ownership around various types of health risk assessments or health risk appraisals for a couple of different reasons, which we don't need to go into now, but there is a tremendous amount of data set, including millions of lives in there. So there's some great potentials to help organizations, benchmark, understand risk profiles, and then use that to improve their own well-being solutions.
Well, Tyler, thank you so much. I have learned so much. I'm sure our audience is going to learn a lot about you, and you've given us a little sneak peek of what you're doing. I know you're a speaker, you're a keynote speaker on the day 2 of the Global Workplace Wellness Summit, and we're so looking forward to having you with us and to learning more from you and understanding the data and what it's telling us.
Yes, thank you so much, Joyce. I'm very much looking forward to the conference. I think it's going to be a wonderful time, and of course, interacting with everybody who's going to be participating in the event. I think it's going to be a wonderful time.
Absolutely. Thank you so much, Tyler.
Thank you, Joyce.